Welcome back everybody, Dr. Schu here. We have a unique case in today. We actually have some quad tenderness, some patellofemoral tendonitis going on with our patient today. She started having some upper right thigh pain, started several weeks ago. She was back on her bike at home, on her stationary bike, trying to get back into the workout routine with the new year and your New Year's resolutions. Kind of overdid it too fast. Was putting in several miles at a time, but started having some tenderness down in that leg. Originally we were kind of looking at the ankle a little bit, kind of the hip, seeing what was going on. We've been treating her low back for several weeks now for other stuff that she previously came in for, but now we're kind of focusing on that right thigh, that right quad area. So last week she came in, we did a full exam, figured out it is the quad. We've done some manual therapy, we've done some taping, we've done some therapy. Been feeling a lot of relief. The first day you could barely walk. Actually sent you home with a pair of crutches because she could just not put any weight on it. Came in today, so it's been 3 visits since then. Actually walking very good. Probably going to take the crutch back from you. But so today what we're going to start with is some muscle scraping of that quad, and then we're going to get into some manual release techniques to release some more of that quad, and then we'll put on some tape to provide some stability but promote the healing while she's not in the office, and then we'll go down the hall and get some therapy done. Sound good?
Yep.
Perfect. All right, so what we're going to start with is some muscle scraping. We're going to focus on the sartorius muscle, and kind of the way we broke it down and figured out it was specifically the sartorius muscle, which is one of the 4 muscles that make up your quadriceps on the anterior portion of your thigh. Is when she was walking around originally, she was having to kind of clamp down on that hip right where that muscle originates, and she wasn't really getting much pain. But as soon as she let off and really started putting some weight on that knee, she was having that referring pain all the way kind of down from that hip into that medial portion of that knee. So what we're going to do is we're going to get right on this insertion point of that sartorius muscle, and we're just going to kind of work that tendon a little bit. Might be a little tender in some areas, but we'll work our way up that leg too, okay? So what we're doing with this is we're kind of bringing some blood flow to the area, but any adhesions, some tightness in the area, we're also kind of breaking up those, letting this muscle kind of respond in a way that kind of relaxes the muscle. So eventually we'll start using some active motion with this too, some leg extension. Sorry, hit a tender spot there, didn't we?
Yeah.
And that kind of helps regain that motion back into this area as well. As you can see, it's starting to turn red. I'll show you guys here in just a minute, but it's bringing all that blood flow to that area so it can kind of promote healing right where we're scraping. Still pretty tender down there.
I'm more in the middle, yeah,
Right there.
Yeah.
Any tenderness up here at all? All right, so what we're gonna do is we're gonna get into some of these tender areas right along the sartorius muscle, which I said earlier kind of inserts here and originates up in this hip area. So we're just gonna kind of work our way through this muscle, and what I'm gonna have you do is just kind of relax that leg, and I'm just gonna come in here, get right on those tender spots, and we're gonna stretch it. Again, we're just kind of letting that muscle relax easing some of that tension. Tenderness up there at all? Okay. Good. Relax. We're going to go on your back. So next one we're going to do is some P&F stretching. All right, so just like before, you're going to relax and then you're going to kick up and I'm going to resist. Okay, so go ahead, kick up. And what she's doing is just trying to extend that knee. Go ahead and relax. And I'm resisting her. I'm not allowing her to raise that leg up at all. And what it's kind of doing is when she's relaxing, after she's been forceful like that, it allows me to stretch that knee a little bit more. Go ahead again. So you can kind of see she's kicking up, but my arm's resisting all that weight. Go ahead, relax. Much better.
Yeah.
Much better than last week.
Oh,
You
yeah.
weren't able to.
I can feel it when
Yeah.
I kick.
One more time.
It's not as painful.
Good. Keep going, keep going. Good. Yeah. Much stronger kick. Good. Just relaxing. There we go. Good. So again, we always, like to check that lumbar spine, check the hips, check the pelvis, the sacroiliac joints. Make sure it's all moving appropriately, because if there is no motion in either one of those places, then another place has to make up for that motion. And so we've been working with the low back. We're continuing to work with the low back a little bit. Also been having some sacroiliac dysfunction a little bit. Not necessarily more than one side than the other, just kind of varies depending on what she's doing. But still getting a lot of good release, a lot of good motion in that low back as well. Good. That was a good release today. So after we did some muscle release, some P&F stretching, some muscle scraping on that area, also adjust her low back and her sacroiliac joints, noticed a lot more motion in that knee without tenderness. Already just got up, started walking around a little bit, noticed a little bit less tenderness in that knee, but how are you feeling overall?
Oh, really good. This is a big difference.
So we're going to continue treating throughout this week, try to get her back to yoga as soon as possible, get her on the bike soon. But we're going to go do some therapy now, get some tape on there to provide some relief while she's not in the office, and then get her back in and see how she's doing. So appreciate it, guys. Thank you again for checking out my videos. Make sure you go check out my Instagram and Facebook, and we'll talk to you soon. Appreciate it.